COVID-19 is not like the flu at all. How do I know? Because I've lived through it to tell the tale. March 3rd, 2020. Bronchitis-like illness started. Dry cough, no fever. March 5th, 2020. Low-grade fever starts. Still thinking bronchitis. March 6th, 2020. Fever climbs from 99.8 to 102.6 in 1 hour. Thought it was the flu, and I was now outside the Tamiflu window. Stayed home for symptom management. March 9th, 2020. Fever of 102 continues. This isn't the flu. Go to urgent care. Diagnosed with pneumonia. Started on Levaquin. March 11th, 2020. 3 doses of Levaquin IN. No improvement in symptoms. Go to ER. Admitted. Swab for COVID-19. IV antibiotics. Got pneumonia on chest CT. March 12th, 2020. Get to a room and place on supplement oxygen via nasal cannula. 1 liter per minute, LPM. I'm only able to achieve 500 on my incentive spirometer. For perspective, my healthy lungs could hit 4,000. March 13th, 2020. O2 saturation begins to decline. Oxygen increased to 2 LPM, then 3 LPM, then 5 LPM. Oxygen saturation 88% of 5 LPM. The decision is made to use high-flow vapotherm and move to ICU. Placed on a 40 LPM and 60% oxygen. I'm terrified at this point. This is because vapotherm is all that stands between me and the ventilator. This is the moment I would have died at home had I not come to the hospital when I did. I would have respiratory arrested in my bed. March 14th, 2020. I've had a bad coughing spell. My oxygen saturation drops to the 80s. I'm still on 40 LPM and 60%. I'm trying to gasp for air, but because of the condition of my lungs, can only take small breaths without coughing more. I feel as though I'm about to die. My heart is racing, oxygen still low. I'm still sweating profusely. I'm in respiratory distress. I press my call light trying to get the attention of anyone who can help. My nurse was in the other room tending to another sick patient. Fortunately, he sees me and comes to my room. And now I'm on 40 LPM and 100% oxygen. Next step is the ventilator. I'm terrified. My breathing slows as my oxygen saturation slowly returns to the 90s. I'm weaned back down to 60%. The same thing happened again in the night. And again, I thought I was about to leave this world. Again on 100%, this time for several hours. I'm slowly weaned again to 60%. March 15th, 2020. My morning arterial blood gas, which hurts like a mother. They tell me this is normal. I get weaned to 50%. March 16th, 2020. My oxygen saturation is 97%. I'm weaned further down to 30 LPM and 40%. March 17th, 2020. I've been in the ICU 4 days. Forced to use a bedpan because my oxygen saturation drops. If I turn or even move too much, I'm unable to clean myself. I'm feeling completely helpless and so embarrassed, but my nurses were great and very understanding. I now truly understand my patients' feelings from all these years of nursing. I'm weaned down to 25 LPM and 30%. I'm going down to the medical floor. March 18th, 2020. I'm weaned down to 28%. I can achieve 1,500 on the incentive spirometer finally. I'm hopeful to be weaned to a regular nasal cannula. The provider comes in. I've been waiting for my swab results. I tested positive for COVID-19. 6.5 days of waiting for the outside lab to process the lab. I'm relieved because finally I have a diagnosis, a reason I've been so sick. I'm weaned down to 4 LPM on a regular nasal cannula. 4 hours later, I'm weaned to 2 LPM. 4 hours later, I'm weaned to room air. My oxygen saturation stats 93 and above all night. March 19th, 2020. As I write this, I'm waiting to attempt a 6-minute walk. Test to see if my oxygen stays up so I can go home. I've had no visitors this entire time due to my isolation precautions. As a 31-year-old, I wasn't supposed to get sick. I wasn't supposed to be admitted to the hospital, or the ICU for that matter. We've already had several deaths from the COVID-19 in this area. I thank God I was not one of them. However, many won't be as fortunate as I have been. Many will die, especially those with lung or heart problems. So please, I beg you, #stay home. Spread the word, and not this virus.